Hey everyone, it's Josh at Prescription Fitness Physical Therapy and Sports Care. I thought I'd bring you just a quick video today. This is a clinical pearl that we see often in the clinic. So a spine patient, and this is specific to a spine patient, but it certainly can happen in other joints. So someone comes in and there's talking of tightness into their neck or into their low back. The immediate assumption a lot of times is when we feel something tight, we go to the conclusion that if it's tight, it must be short. But a lot of times what we actually see is that something that's tight is really an overused muscle. The muscle has gone into a guarding mode or protective mode because let's say I present with a lateral shift. So if I present with a lateral shift of my head going to the right, the left side is going to feel tight simply because the muscles are on overload. Our head, depending on where we cut it off from the spine, don't ask me why I know that fact, but if I cut it off at C01, which is the very top of the spine, it weighs 12 pounds. So if my 12-pound head is hanging out over here all the time, what happens is that all the muscles onto this side are under structural overload. So it feels tight, so the perception is it's tight, but in reality what it is, it's lengthened, and so it's overloaded, it's overworked. So the mistake for a lot of people, including physical therapists, if we're not really paying attention, is that we're going to stretch it more. So now it's a novel stimulus. The body interprets that and says, hey, here's a new stimulus. It feels better, so I'm going to stretch it more. But intuitively, that doesn't make any sense. It's like having a cut on your knuckle and saying, okay, well, if I bend my knuckle, geez, that hurts. So if I bend it further, it'll make it feel better. Well, yeah, we know that doesn't work. So a lot of times when we feel something to be tight, it's not really short. It's overworked and long. And so what you want to do is a lot of times we go into the side of the pain. So in the case the cervical spine example, so if I have a lateral shift going to the side, what I want to do is I want to make sure that I'm doing side bending into the painful side, which helps to put that structure on slack, and it makes it feel better. I see that there's sunlight behind me. That's like a halo effect. Maybe this is, this is the world saying, hey, that's a true clinical pearl. So there you go. There's your tip of the day. So if you have something that's tight, especially into your spine, try going towards the side of the pain and try doing it repeatedly. Because if I do it once, that's not going to change anything. If my head's in one position all day long, what makes me think doing one set of 10 into the painful side is going to correct that? We need to do it all the time. So it's a matter of taking that stimulus, repeating it over and over like a car that's stuck in the mud. I'm going to kind of rock that thing and get it moving. So try that, see how that works out for you. And again, it's Josh at Prescription Fitness.